Okay, so when you think about a high-stakes surgery, what pops into your head? You're probably picturing the surgeon's steady hand, right? Or maybe the anesthesiologist watching all those monitors. But what if I told you the most critical, life or death decisions often get made long before anyone even picks up a scalpel? Seriously, think about it. What's the most dangerous part? Is it the actual cutting? Is it going under anesthesia? Maybe it's the recovery afterwards? Our minds almost always jump to what happens during the operation. But the real answer? It's often hidden in that crucial time before the surgery. This is where one tiny overlooked detail can trigger a total catastrophe. And this is the domain of an unseen guardian, the preoperative nurse. So let's break down what they do. First up, their role is basically that of a detective. They're trained to hunt for these hidden threats that, honestly, patients don't even know are threats in the first place. The clues are hiding in plain sight. And it often starts with something that sounds completely harmless. A patient casually mentions they take a few herbal supplements, to stay healthy. For most of us, that's a total non-issue. But for an expert preoperative nurse, that's a massive, flashing red flag. I mean, just look at this list. Ginkgo, garlic, ginger. A lot of us have this stuff in our kitchens right now. But when you're about to have surgery, they can act like powerful blood thinners. And others, like St. John's wort or valerian root, can mess with the anesthesia in really dangerous ways. The nurse knows these have to be stopped, sometimes for weeks, to prevent a patient from bleeding uncontrollably on the table. Next, the nurse detective starts digging into the patient's surgical history. And they're not just looking for the big stuff. They are searching for very specific procedures that have lifelong consequences. And this is all about protecting a patient's lifeline. For instance, if a patient had a mastectomy in the past, the circulation in that arm might be compromised. An AV fistula, that's a special access point created for dialysis patients. It is, quite literally, what keeps them alive. If you put a blood pressure cuff or an IV on that arm, you could destroy it. So the nurse's defense is simple but brilliant. A colored band that basically screams, "Do not use this arm," to the entire medical team. And sometimes the biggest threat is something as simple and as surprising as a piece of gum. We've all heard that nothing to eat or drink after midnight rule, but most people have no idea why it is so deadly serious.
So here's the biologic why, and it's fascinating. It's not about sugar. The act of chewing anything tells your stomach to start making acid. The problem is, when you're under anesthesia, your body's normal protective reflexes, like coughing or gagging, are completely paralyzed. So if any of that stomach acid comes back up, there's nothing to stop it from going straight into your lungs. We're talking about a severe chemical pneumonia, all from one little piece of gum.
But the nurse's job goes way beyond just the medical side of things. They have to switch hats, from detective to advocate, and become the patient's legal and ethical protector during the consent process. This, right here, this is the golden rule. It is an absolute, ironclad, non-negotiable law of the land in medicine. The second a patient gets any kind of sedative or strong painkiller, their legal ability to make an informed choice is gone. Poof! The nurse is the final checkpoint to make sure that line is never, ever crossed. The legal boundaries here couldn't be clearer. It's the surgeon's job to give the information. What are the risks? What are the benefits? What are the alternatives? The nurse's job is to verify the patient's understanding. They are the official witness who confirms, yes, this person gets it, and they're signing this willingly. Okay, so let's play out a scenario that happens all the time. The patient has the pen in their hand, they're about to sign, and suddenly they get nervous and ask the nurse, "Hey, can you just run through the risks one more time for me?" What does an expert nurse do? This is the one and only correct move. The nurse legally cannot explain the risks of the surgery. That would be practicing medicine outside their scope. So their duty as an advocate is to stop everything, put the pen down, and call the surgeon to get back in that room and do their job. That single action protects everyone, the patient, the nurse, and the entire hospital.
All right, and for the final shield, the preoperative nurse has to become a specialist. They have to tailor their care for specific at-risk patients, because a one-size-fits-all approach isn't just a bad idea, it can be incredibly dangerous.
Take older adults. The biology here is key. They tend to have less insulating body fat, and their liver and kidneys just don't clear drugs as quickly. That makes them super vulnerable to two things: hypothermia, which can cause deadly heart problems, and drug toxicity. So the nurse has to be proactive, getting warming blankets on them from the start and talking to the anesthesiologist about maybe needing lower doses. Now, for bariatric patients, the risks are more mechanical and circulatory. The physical weight of excess tissue on the chest can actually restrict breathing when they're under anesthesia. And because fatty tissue has poor circulation, the risk of developing blood clots goes way up. So the nurse's defense is just relentless surveillance, watching their breathing and using special devices to keep the blood moving properly in their legs. And what about a trauma victim who's rushed straight to the OR? Unlike a planned surgery, they haven't been fasting. The stark reality is they almost certainly have a full stomach. With their reflexes shut down by anesthesia, the risk of them aspirating all of that into their lungs is sky high. So the nurse's immediate priority is anticipating the need for a tube to quickly empty the stomach before they're put to sleep. So after all of this, all the detective work, all the advocacy, all the specialization, what's the actual impact? Well, it really comes down to numbers like this one. 50%. That's right. About half of all surgical site infections, which are one of the most common and dangerous complications you can have, are considered preventable. And that prevention starts with the work of this unseen guardian, from catching that herbal supplement to ensuring the skin is prepped just right. It's the first line of defense against infection and harm. So yeah, the surgeon is the one holding the scalpel, but the safety of that entire complex procedure, it rests so heavily on the shoulders of the nurse who prepared the patient for it. They're the detective, the advocate, and the specialist, the true unseen guardian of the operating room. Kind of makes you think about it all differently, doesn't it?